2, 1.
Hey everybody, it's Dr. David. Welcome to another Ask Dr. David Live, where you get to have an exhilarating, exciting conversation with me if you submit any messages. And of course, every time we first submit, we ask for questions for people online. Our Patreon members get first dibs, and other people who are subscribing to our newsletter, and then everybody else. I already looked and saw some really neat questions that we have for today. I always want to remind people that these do not constitute medical advice. This is more of an educational. Obviously, everybody's different. Their healthcare is different. Their lifestyles are different. Their nutrients are different. So we are talking in generalities here. And while I'm happy to discuss medical conditions as a whole, I don't discuss a person's individual situation. So manning the board today is Whitney. Whitley, I said your name wrong. That's my daughter's best friend is Whitney. Whitley, hello, Whitley. Sorry about that. Who is going to be sending me the questions today and manning the board. So, what do we got for us today here? All righty. Question number 1. Is Vyvance, which is lisdexamfetamine, more effective than Concerta, which is methylphenidate? Okay. So, what this is asking about are two different stimulant medications that are very commonly prescribed for ADHD. Okay. Now, in terms of more effective, okay, that's not really the way that I would look at it because different people respond to these medications differently. So, in one person, they may respond incredibly well to one and not have much of a benefit or even a negative effect from the other one, and vice versa. Okay, so the Vyvance, so the lisdexamfetamine, that is also like the Adderall category. That was like the first amphetamine salt that came out. And then methylphenidate, that is Ritalin. Okay, so Concerta really isn't that much of a difference. Extended release. There's also extended release Ritalin versions out there, and there are newer versions of those as well. Okay, and I've seen psychiatrists who say, "Oh, this is the best one for these particular symptoms." I haven't really seen that to be so. When I discuss this, a couple questions that come up from me, is there if a patient needs to be prescribed these medicines, so is there anybody else in the family, any sibling or parent for that matter, who's taking one of these medications? If the answer is yes and it's been successful, that's actually the first one I'm going to go to, everything else aside. Okay. But another thing that I look at is, quite frankly, what's covered by people's insurances. If it's not covered, it can be expensive, or there could be, one medication can be on one tier of the formulary and another on another tier. And of course, if I could save somebody 10, 20, $50 a month just because I chose one, then that's what I'm going to do. But it's a trial and error type of thing. And regardless of what the medication is, I start low. In fact, I often even start lower than the recommended starting dose for a given age. Or I know that there's a body weight conversation and computation, which I also don't find very helpful. I just go by the age range. But at the same time, one of the nice things about stimulant medications, it works instantly. You pretty much know what you got the first day out, the good, the bad, and the ugly of it. Okay. Which is kind of nice, if other things about, I know that especially in the functional medicine holistic world, that stimulant medications get a pretty bad rap. And I don't have that negative of a feeling about it because it is the way it is. It's kind of like the perfect drug for a doctor to be able to guide somebody to. Because obviously, what would be the ideal thing? A medication that what works, or if there's a side effect the first day. Another thing about the stimulant medications with the other non-stimulant ADD medications you cannot do is you can take weekends off. You can take holidays off. You could bump the dose up, you could bump the dose down pretty much as will. And those are wonderful qualities for a medication for me trying to help a patient out. So that's why I kind of like using them if we need to. But of course, from a functional medicine perspective, we need to dive deep, right? We know how microbiome, I've seen so many kids who have either intestinal candida or Clostridia bacteria, and the toxins that they make, which we can show up on our urine organic acid test. Also doing stool tests to identify those particular organisms, and if they can find them, they can actually do a sensitivity panel. Like for a UTI, they can tell you which antibiotics to use. So I of course want to look for the root cause, and there's lots of things that I will try naturally, omega-3 fatty acids in higher doses, theanine, taurine, etc. But sometimes I get a patient who comes in kind of in crisis mode. He's so hyperactive, they're going to kick him out of his classroom. They're kicking it, may not trying to move him out of the school or something like that. So in case of emergency, break glass. It's a wonderful thing that you can very quickly figure out if it's going to be helpful or not. And there are people who will stay on it while we're adjusting and looking for the root cause issues, and adjusting all of the other things. And then once things are settled, then we say, okay, let's say you do without it, right? And if they stop it and all of a sudden things go not so well, you start it back up. You make a few other adjustments on the functional medicine side, and then go down the line, let those things settle in, and then you stop it again. And then you can play that game back and forth, but it's a safe game to play. You're not hurting somebody by doing it that way. So that's my overall take. I don't think that one is more effective than the other, and those other variables are much more involved with how I choose which medication may help somebody. Okay, so the next question: how would you treat SIBO? Okay, so first of all, SIBO is small intestinal bacterial overgrowth. Okay, and this can cause issues from abdominal symptoms, but even concerns about potentially contributing to leaky gut, which is increased intestinal permeability. Okay, so the first thing is defining it. Okay, and the way that it's most commonly done is what's called a hydrogen or a methane breath test. And this is where a person drinks a glucose and watery solution, and then afterwards they then do a breath test. And you check beforehand to see I guess a baseline. But if you see a sudden spike in the hydrogen or methane right after consuming this, not right after, because it has to get to the small intestines. Obviously, you first have, when you drink it, it first goes to the stomach, so you have to give enough time for it to pass on through. But if you do see this spike occur, then that is pretty strong evidence that there is SIBO present in the first place. Okay. Now, in addition to that, there are other ways of checking for it. The kind of the gold standard, but it is invasive, is an endoscopy, a scope that goes down into the past the stomach, so through the esophagus, past the stomach, into the small intestine, where they can do an aspirate. They can collect the fluid there itself and then see if in that fluid, if there are the bacteria that is present. So there's a few different ways to be checking for it. Okay. Now, in terms of treating it, okay, yes, there is an antibiotic. Most commonly, the one that is used is called rifaximin, and it can be rather effective, and it's something we use. But there are a lot of other aspects to this. Okay, so again, how is the microbiome overall? I like to do our stool and urine tests to see if there's evidence of Candida, Clostridia, how the levels of the good guys are. So can we find that, getting rid of those bad guys, as well as, more importantly, making sure the good guys are there, making sure that people are eating healthy foods, prebiotic foods to help the good guys grow. Okay, can that force out the bad guys? And that would be certainly one of the first things that I do. You also, it's interesting because when a person has SIBO, in the small intestines is where we absorb most of our nutrients. So because of the inflammation that SIBO can cause, then also it may not let certain nutrients absorb as well. Okay, so things like vitamin B12, vitamins, minerals, calcium, etc. And of course, if those things are off, then that could also make our ability to fight off infections more. So it's almost like a vicious cycle that can go back and forth. So, looking at those things to see if there's any nutrients that we could potentially, B12, you may have to give it as a shot. And to bypass the stomach altogether, 100% gets into the body when you give it as a shot. So there are those types of things that you do. Also, being lactose free could make a difference for these people as well, in part because the carb, especially the lactose, besides causing inflammation itself, especially if it's part of dairy with cow milk protein, but also the inflammation that can come about from a reaction to that can also be contributing to a difficulty in getting rid, because if all the inflammation's there, again, we're not going to be absorb our nutrients as well. So that's the typical approach that we take for SIBO. Okay, So so here's the next question. What supplements help methylation function optimally, apart from MTHF? Okay, so let's first take a couple steps back. Okay, so I know on this channel, even when I had my great conversation with Dr. Ben Lynch of Dirty Genes and methylation, if you go back a couple years, you'll find that in our library on our YouTube channel, where we went into a lot of these things at depth. So first, before we talk about supplements that help, let's talk about what it is. Okay, so methylation itself is the taking of a carbon with a couple hydrogens; those are called methyl groups, and putting it on or taking it off demethylation onto genes to tell us which ones to read, onto toxins that can help ourselves detoxify. Okay, so some very important functional roles there. Okay. Now, the methylation is a cycle, so it actually comes back and it feeds on itself. And the feeder that kind of starts it all off is the activation of folate and turning it into methylfolate, which is done by an enzyme called MTHFR, of which there are two different mutations. There's a minor mutation, A1298C. And if that's all that's there and it's only one copy, that's probably not even clinically significant. If there's two copies, probably a little more. But there's also a major one called C677T. And sometimes you'll see that alone with one normal one. You may see it with a combination of one of those A1298Cs, so one major, one minor, or the least fortunate would be two of the C67717 majors. Okay. And every time that there's a mutation, and obviously major more than minor, it slows the ability of the body to activate folate to create this methylfolate, which is then again the introducer into this methylation pathway. So a methyl group, that carbon, is put onto folate, and now we have methylfolate. Now, the next step in that process is to take that methyl group off of the folate and give it to B12 to make methyl B12. And there are enzymes MTRR as opposed to MTHFR that's involved in making that happen. And then that goes into the cycle, which goes on to methylate methionine into acetyl methionine and around to homocysteine, and it can come back around again. But then there's also, besides the cycle, there is what's called the transsulfation pathway. So that homocysteine can either go back for another loop or it can go down. And then with the aid of vitamin B6, can then create cysteine, which creates N-acetylcysteine, which people in their supplements have heard of NAC, which then goes on to make glutathione, which is super important for detoxification and reducing inflammation. Okay. Now, the reason why we do this max function, this is the genetic test, the nutritional genetic test that we do, is it tells us if a person has mutations or non-mutations in the genetic code that codes for those enzymes that make those reactions happen. Okay. So if a person does not have an a mutation, they may not need a lot of extra support in the methylated world. Just giving them the regular nutrients of B12 or folate or whatever, maybe all they need, because then their machinery comes in to do their job. But when you look at each individual, and you can then see what is actually not going to work, so you can kind of jump on it and kind of get that going, because this is a genetic finding. If it does help, these are things people would have to stay on for life because of the fact that it's genetic, and at least in this decade we're not able to do gene therapy to the point where we can fix those things. Who knows, maybe someday we will. But at the same time, there are other things that can help promote methylation pathway. Choline, which is vitamin B4, different B vitamins, as I mentioned, not the B6, the B12, the folates, but also there are two methyl donors. One called DMG, dimethylglycine. So it's glycine, which is an amino acid that has two dimethyls hanging off the side, and they can serve as methyl donors. And there's also trimethyl glycine, TMG. So it's three methyl groups on that same glycine amino acid, and that can serve as an even more of methyl donors as well. So we need the methyl donors in order to give that carbon with the hydrogens. We need these enzymes to be working properly in terms of taking those methyl donors and putting them on those various substances. in order to make the pathway work. So, really it's not a one size fits all. Yes, you'll see that there are supplements that are like methylate and those types of things that will be that they say has all the methylated vitamins. And there's nothing wrong with taking them, and if there's no side effects to it, some people can be over methylated. There's another gene in our panel called COMT, and if you have too many of those, you can be sensitive to methyl groups, and you kind of may need to go in some other side about B vitamins in order to get the functioning happen, because there are some substitute ones that we can do. But knowing what a person's methylation genetics is showing can really help guide on an individual basis what a person needs so that they can optimally keep inflammation under control and detoxify. So hope that answers your question. Okay. What are some possible causes of low iron and high platelets in a woman in her mid 40s that has never had an abnormal platelet count? Hemoglobin is normal. Ferritin is on the low side, but in range. Okay, so first of all, there's much more of a medical history that would need to be taken here, because there is some differential diagnosis. I mean, anemia in and of itself can cause what we call thrombocytosis, which is too much platelets. Okay, inflammation can also cause increased in platelet counts. Now, cancer can too. Okay, and now if a person, and again, part of this does also depend on how high is the platelet count. Usually, you'll see platelet counts cut off on the lab test 350, 450. And if a person has a 470 or a 500, and everything else is looking fine, a CBC blood count isn't showing any white blood cell abnormalities, there's no other signs of cancer, there could have been just a virus that could have been enough to make it go off. So, repeating the tests for the platelet count to see if it's going up, going down, staying the same, can be useful. Right. But of course, that's where part of the history comes into place. This is a person who may be having low energy? Are they losing weight inappropriately? Are they not able to eat? Do they have some sign of inflammation? Autoimmune conditions can also make this happen. All of those being signs of inflammation. So colitis is hyperinflammatory conditions. Long COVID can make it go up. COVID can make it go up. So really, you kind of want to look at the pattern over time. Okay. When it comes to low iron, it says that the ferritin is on the low side, and I don't actually know what that means for this individual, because typically you'll see ferritin levels. Now, ferritin is the protein that stores iron. It's the best indicator of long-term iron status. Okay. Now, we like to see ferritin levels be above 30. It's because they get the iron stores up. But on the reference ranges, you may see that a ferritin above 7 is normal, or above 12 is normal, and it does change by age. So, of course, without knowing, what the reference range is and what the number is, I may assess that ferritin level differently. That ferritin level differently. But on the platelet side, it's kind of the way I just described it. Okay. Why don't you talk about Epidiolex? Okay, so let's first start off saying what it is. So Epidiolex is the prescription form of CBD. So going back to the original research that was done, Epidiolex was a pharmaceutical that was put forth, high potency CBD, 100 milligrams per milliliter. There are now over-the-counter companies that can make that high concentration. But back when it came out, you'd see maybe 10 milligrams per ml, 20 milligrams per L25, but you rarely saw anything above 50. And this was the actual product that was used to determine that it can help with seizures. Okay, not THC, CBD. Okay, now the reason why I don't talk much about it is, first of all, but from a prescription perspective, unless a person has epilepsy, and there's actually just a couple diagnoses that are actually FDA approved for it, although you can go off label for other forms of seizures. If it's not covered, it's expensive. Okay. But the other issue for me is that it's an isolate. It's only the CBD. Now, if you understand plant-based medicine, you recognize that there's lots of ingredients, there's lots of constituents within a plant. And it is believed that all of those things work together to have healing properties. So in this case, the Epidiolex is only CBD. There's no other minor cannabinoids in there. There's no THC in there, but there's no terpenes in there. There's no other flavonoids in there. So it's just the isolate. So I am not convinced that it's the best way of using the plant in order to help. But hey, if it works, great. But the other thing is this: it has sucralose in it. Okay. Now, originally we heard about saccharin, and then we switched to NutraSweet because people were concerned about the saccharin, and then people became concerned about NutraSweet aspartame. So now they don't even put the word aspartame; they just put NutraSweet on there. And then people moved to sucralose. But there has been research, and I know I did an Ask Dr. David video on this, that there are problems with all artificial sweeteners. Okay. And so I don't want to be giving artificial sweeteners potentially in some daily kind of amounts to a child if I can. Okay. So, when I use a CBD, and, I use a company called Miriam's Hope because I really like their transparency in terms of their third party testing for both accuracy and purity. And you can pick your own terpenes. It's not, it's certainly more a wider spectrum of other things that are in there except for the THC, but you can also choose your own terpenes, which can help on other things. So some are more terpenes will bring you up or bring you down. And this company does have 100 milligram per ml. They even have a 200 milligram per ml, but it does not have artificial sweeteners. It's flavored based upon essential oils. And it's olive oil that's in there. So most people can handle that. So that's the reason why I don't, it's not that I don't talk about it. And I've had patients bring it up and I've prescribed it. But from a holistic perspective, I like the concept of whole plant medicine and using those other ingredients in there. But as I said, I'm not opposed to doing it. But that's why you don't hear me talk too much about it. All right. Okay, a two-part question. So I'll say them both and I'll tackle them separately. Okay. Is red meat really that bad for people? I find eating ground beef makes me feel good. Number two, eggs have a lot of great nutrients, yet doctors say eggs are bad. Are they really that bad, especially when you scramble free range eggs? Okay. So, first of all, there are few things that are bad for everybody. Smoking and alcohol. I'll put those up there for everybody. Okay. I guess a bullet would not be so good for you either, but hey. Um, there are people who handle red meat just fine. Their cholesterol levels don't go fine. They don't have any inflammatory problems. And I know people, they feel like they need the meat. They feel it's the best way to get their iron. They get energy from it, their protein sources. And from my perspective, if people are not showing high cholesterol levels, if they're not showing inflammation, if they're not showing any problems in terms of heart, buildup of things in their heart vessels, etc. No, I don't think 100% of people need to be avoiding red meat or animals, even though I do advocate a plant-based diet. But that's also in people who are having issues, whether it's the cholesterol, because cholesterol is only found in animal products, not found in plant-based products. Of course, humans make it, so we could be doing it. There's even, familial hypercholesterolemia, where people are genetically programmed to make more on their own, and that could be a bit of a problem. Um, but I would certainly say if there's no problems to it and if a person feels better for it, I'm not telling that person to avoid meat. But I think you got to be cautious. You got to be on top of it. Do your homework, if you will, and do your testing and just follow those things to make sure that we're not seeing something creep up, right? Because cholesterol, blockage of the arteries, those don't become problems until it's an obvious problem, and we want to catch that on their own. Now, in terms of eggs, okay, so first of all, let's differentiate between egg whites and egg yolks because egg yolks is where the cholesterol is, okay, not in the egg whites. Okay, so when I make myself an omelet, for instance, I'll put one full egg in and I'll do the rest as egg whites. So it still tastes like eggs and it's yellow and all that stuff like that, but I'm lowering my cholesterol intake. Okay. But again, not everybody has high cholesterol. And yes, besides the protein that's in there, choline, very important B vitamin is in there. Very important for both liver and brain and cardiac development. So scrambling up a free range. So obviously free range is certainly better ethically for the animals, but also getting organic, not just free range, because of the what they're feeding those chickens to make those eggs, and that's obviously something we want to be mindful of as well. Now, what I recommend people be eating eggs and red meat for 21 meals a week? No, of course not. I think we need a lot of variety. And of course, what else are we consuming there? How much of other healthy foods are we eating, right? So are we eating processed sugars, ultra processed foods, added sugar types of foods, which are just as bad for some people than those other foods that we were just talking about. So as with everything, it's individualized. Okay. If you're fine with it, if you're source fed, you feel bad if you don't eat meat, eat it. Just make sure your cholesterol level is fine. Make sure that that just overall everything is looking good. But if your body handles it, your body craves it, and you seem good with it, and you're eating lots of vegetables, and you're not eating other inflammatory things, because red meat and animal products can increase inflammation in the body, but all those other things that I was talking about also can increase inflammation. Coming back to in terms of any of the supplements, there are things like vitamin D and zinc that keep inflammation under control. Omega-3 fatty acids, another big one. Again, it's an overall experience, and I know that we will hear news blurbs about the dangers of this and the dangers of that, and they don't go into a lot of context. And of course, that's why I like to take a one-on-one approach to it, and take time to explain to people what's going on. I realize that my explanation right now may have been as much time as somebody gets with their doctor in total, right? You only get like 5 minutes with your doctor. And of course, that's part of the issue with the healthcare system in our country, is that people don't get enough time with their healthcare providers to delve deep. And, part of the reason why is because people take insurance, because when on insurance, you don't really have the time. Doctors have to see 4 patients an hour. You don't have time for all of that. And a big reason why I have skewed using or taking insurances, because I want to spend the time with my patients that I need. I want them to not feel shortchanged, but I also realize I got to keep the doors open, and just insurance won't cover for those types of things. We've looked, we've tried, we're continuing to look, we're continuing to try, but at the end of the day, I want to spend the time with my patient that they want me to spend with them. Okay. Wow. Okay, no further questions. So we got 30 minutes in here, but I know we jam packed a lot of information in there. And of course, thank you for those who submitted these questions. Keep coming every month. These are things I get to learn myself. When you submit, I actually get to look a couple of things up myself to make sure I have a good answer. But I enjoy being put on the spot, and that's why I like it when people submit questions, even when we're going. It's kind of like when I'm with the patient. You never know what they're going to ask you, and they can do that. But if you enjoy this, this video will be available afterwards. Please share it with other people. And if you're not subscribed, or people that that would like this type of information, a functional medicine approach from a pediatrician who's seeing from all different angles, who also takes care of adults, again, please ask them to subscribe. Check out our TikToks, where I'm putting up more fast things up there, and our other social media. Join us on our Patreon, where you get first access and information to our documents that we would ordinarily only share with our patients. So hope everybody has a good month. And we'll be, I think we're actually going to be not doing something in August and October. So if I think that, and the message will come out, but I think we decided that would be an early part of October, that we early part of November, excuse me. So did I say August? I think we're not doing October, but we're doing early part of November, if I'm not mistaken, and then again in December. But we'll be sending out all that information, so you know about it ahead of time. So have a great week. Oh, wait. Something just came up here. Ha ha, look at that. One quick question. I have allergy to egg whites. Any recommendations to egg whites but still have nutritional breakfasts? Okay, well, there are certainly plant-based egg products that one can use that are not made with eggs. There's obviously lots of other ways that we can get proteins. Oatmeal is full of protein. If a person does want to eat meats, there are obviously other forms of meats as well. So there's nothing magical about egg whites. And there's just lots of other foods that are out there. Of course, in general, breakfast foods are the least healthy foods of the day, whether it's the waffles or the pancakes, or, how we're cooking our eggs, or all the saturated fats that's in bacon and sausage. But again, there's plant-based versions of those as well that won't have all that cholesterol and those kind of animal fats that are in there. So, the main thing is, as long as you're getting your proteins. Egg is a good protein for people because it's a complete protein. As you may know, only animal-based proteins, meats or eggs have, or dairy for that matter, have all of the amino acids in it that we need. And there's no single plant that does that. That's why people have to kind of mix and match their plant-based proteins in order to get everything that they need. But there's lots of options out there besides eggs as well. So so obviously, send us along, share it with people, sign other people up, get them to share the love with us. All right. Have a great day.